So, World Africa. The Trump administration has gutted USAID for family planning. So here's how it impacts women overseas. This is by Lauren Kent, April 25, 2026. So CNN spoke to a medical provider, nonprofit in 6 countries, who described layoffs of health workers, widespread birth control shortages, and worsening outcomes for women. So nurse, I may not be able to pronounce the names because they're foreign names. So Kefini Ojunga said that she has seen a lot after nearly 3 decades of working in the reproductive health care in Kenya, Kilifi County, on the East Africa, our African country's coast. But things got markedly worse for women there in the past year amid the sweeping cuts to the USAID programs. So throughout developing parts of Africa, the U.S. funding once provided free birth control, maternity checkups, and other reproductive health care by a mobile medical clinic, services that abruptly vanished as the Trump administration has dismantled the U.S. Agency for International Development, which is called the USAID, and it has slashed the funding for family planning. Now, you may ask, well, these are people that are in another country, and how does this affect people here in the U.S.? If they do something to one group, and I'm a firm believer of this, they're going to do it to other groups, whether it be out of the U.S. or inside the U.S. And I'm bringing this to your awareness because if they can cut these programs, the very programs that we have for people who have HIV and who are getting care for HIV, those programs are at threat to be cut as well. And they have been cut. But people are not really paying attention to that because they feel like right now they have access to medication. But if they can cut any of these programs off, there are more cuts that are coming. And I'm warning you. So throughout the developing parts of Africa, the U.S. funding once provided free birth control, maternity checkups, and other reproductive health care by way of a mobile medical clinic, and the service has abruptly vanished as the Trump administration dismantled the U.S. Agency for International Development, which is USAID, is what it was better known as, and it has slashed the funding for family planning. So each day in Kilifi, we count several unwanted pregnancies. This was said by the person that is talking about this, Ojunga, who works for the nonprofit Reproductive Health Network in Kenya. So the nonprofit has warned that clinics throughout the country have run out of birth control. We've seen cases that led to deaths, and we are still yet to see more coming with sepsis, coming with hemorrhage, and coming with shock. So the frontline nurse described seeing firsthand a detrimental health impact of women trying to terminate their own pregnancies by taking high dosages of painkillers, obtaining drugs for abortion without a prescription or medical supervision, or consuming toxic substances like detergent. So over the past 6 months, CNN has spoken to multiple medical providers and nonprofits in 6 countries who describe layoffs of health workers, widespread shortages of birth control, and persistent supply chain challenges, particularly in remote areas where women have few options, as factors making the situation worse. So it's a crisis in family planning medicine that is playing out across the African continent in the wake of the aid cuts by the U.S. and other donor nations. So, as I pan down, you'll see clinics where women are waiting for health care. So, a mobile clinic that is set up by a reproductive health network in Kenya and Kilifi County, which can take medical providers hours to reach, gives reproductive health services to women in these communities. And that's what you're seeing right here. So it goes on to say that the International Planned Parenthood Federation estimates the funding cuts have forced 1,400 medical clinics to close around the world. So resulting in 9 million people losing access to sexual and reproductive health services in 2025. Now the Trump administration budget request for fiscal year of 2027 proposes more cuts to global health programs, reducing funding by billions of dollars, specifically eliminating all reproductive health programs. The budget proposal says that the White House aims to ensure no funding supports unfettered access to birth control. So the president's budget request is not binding as Congress approves funding, but it is indicative of the administration's spending priority. So Nebiha Kazi Hutchins, president of PAI, a reproductive rights NGO based in Washington, told CNN the proposal wording makes it clear that what they're advancing is a political ideology and not public health evidence, and that it shows an incredible abandonment of decades of bipartisan U.S. commitment to internal family planning, or international family planning, that is. So in 2024, 43% of the global family planning aid was funded by the U.S., according to the health policy nonprofit KFF. That funding formally gave 47.6 million women and couples access to modern contraceptives, according to an analysis of 2024 budget by Guttamacher Institute, a research organization focused on sexual and reproductive health that supports abortion rights. But early last year, the Trump administration froze and then scrapped family planning grants once administered by the USAID program. So the administration also reinstated and expanded a U.S. policy barring international NGOs that provided abortions, give counseling about abortions, and advocate for the safe access of abortion from receiving U.S. government funding. So then, in July, Congress rescinded $500 million intended for family planning and reproductive health programs. The U.S. administration also stopped all contributions to the United Nations Population Fund, the UN Sexual Reproductive Health Agency, withheld $9.7 million worth of U.S. purchased contraceptives in warehouses in Belgium rather than delivering them to women overseas. Experts warn the impact of further spending cuts on women's lives will be significant in 41 countries that once received the U.S. aid family planning support, many of them in Africa. So that is a doctor in Tanzania who inserts birth control implants into a patient's arm in an image provided by Engendered Health, an organization working to advance reproductive health in Africa and Asia. And so that's what this was right here. And so underneath, you see what looks like a nurse talking to a mother. And it was regarding family planning. A clinical staff member explains different birth control options to a mother in Tanzania. This is in the clinic in gender health clinic. So in Mozambique, and aid workers reported 7% increase in recorded teen pregnancies last year in areas where services were scaled back after the U.S. funding cuts of UNFPA, a global fund, hampered efforts to reach some of the most vulnerable communities. So there's a direct correlation between the withdrawal of our assistance and the increased vulnerability of young girls. Santos Simone, director of Mozambican Association for Family Development, and it's abbreviated, told CNN by email. So every percentage point of this increase represents girls dropping out of school and the perpetuation of the cycle of poverty, and more importantly, and that's what I want to get to, is the rise in HIV infections and an increase in child and early unions. So in Malawi, one of the world's least developed countries, a local NGO affiliated with International Planned Parenthood Federation raised the alarm that late last year, the impacts on women who had lost access to mobile clinics, care, and contraceptives in 2025. So I waited for the clinic to come. 24-year-old Ulemu Pili told the Family Planning Association of Malawi at the time. So they used to come every month, but after the aid has been frozen, they never came back, and by the time I realized it, I was already pregnant. So that is her picture there. And she says here, Ulemu Kapeli, 24, told the Family Planning Association of Malawi about her experience of losing access to mobile clinic care last year and having an unintended pregnancy. So this is her right here. And so medical providers and nonprofits working in Africa say that U.S. cuts to family planning services have led to deaths, unsafe abortions, hemorrhages, and worsening maternity care. So asked by CNN about the claims, a U.S. State Department spokesperson said that the American people expect their tax dollars to support programs that save lives, advance U.S. interests, reflect American values, not fund abortion-related activities, left-wing social agendas, and wasteful overseas bureaucracy. So that's the reason for their premise, the groups that have cut the funding. So the administration focuses, the spokesperson added, is on implementing life-saving care in global health priority areas, including HIV, AIDS, tuberculosis, malaria, maternal and child health. Okay. So quality of care compromise. So research shows, however, that access to modern contraceptives, the ability to prevent the space-out pregnancies, improves maternal mortality rates, family incomes, and babies' health. But what's more, health providers in several countries told CNN that birth control services are often integrated with other medical work as well, like HIV, AIDS prevention, and obstetrician gynecologist care, which have also been impacted because of these cuts. So if nothing is done, then there are going to be some dire consequences. This is said by a Patrick Kenemi and the Tanzania country director for the organization called MSI Reproductive Choices, which works in dozens of nations to provide reproductive health care. Tanzania alone is facing a funding gap around 18.3 million for contraceptives like birth control pills, implants, intrauterine devices, which are called IUDs, this year, according to MSI. So those contraceptives would impact women's lives for many years beyond 2026, so MSI said, but this year alone it would have prevented 1,600 maternal deaths, according to its own analysis. So he noted that the improved family planning is responsible for a significant reduction in the country's maternal mortality rate. Without these commodities, that could reverse. So I feel like when one group suffers or other nations suffer, it will eventually come this way around. So I'm sure that this article will match what is going to come in the U.S. when it comes to women's reproductive health.